Today on Gracefully Graying, I am pleased to welcome as my guest Stuart Kay as we explore some key public and population health issues that impact upon all of us who are gracefully graying, especially during this era of coronavirus. Stuart, welcome.
How are you? And Henry, thank you for having me on the virtual show today.
Well, it's a pleasure. First of all, why don't you tell us what is a certified senior advisor?
So about 18 years ago, a friend of mine suggested I was getting involved working with seniors that I go to a program called the CSA. So it's basically a society started in about 1997 called the Society of Certified Senior Advisors. The group was originally developed really more heading toward financial planning and attorneys and things like that. It started in 97, so back then the baby boomers were mid 50s. I took the program in about 2002. It was still mostly financial people, but over time the CSA has really become a designation for anybody working. The majority of people now are healthcare people, people involved with transitional care, and it gives you an understanding of how to talk to seniors, how to identify, how to understand what it feels like, to gracefully gray. So I took this. I wasn't even 40 years old. Okay, well, I look at it. I'm like, oh my God, time goes by. First thing they did, as silly as it sounds, it's not, I'm wearing reading glasses today. Didn't wear glasses then. Is they actually told us to put on these dark glasses and take our rubber bands together, our fingers together, and try to show you, movements. Things were more difficult. Seeing was more difficult. Dealing with daily, your ADLs, activities of daily living, was difficult, and I had never heard about that. So that was really, my exposure to the CSA program, and it's, it's grown nationally, and it's, very well recognized.
Stuart, tell us a little bit more about your background and share it with us and our viewers.
So it's only a 30-minute show, so I have to condense it. So, I grew up not too far from here in Oak Park. Physically not too far from where I was at, but over the last 34 years since graduating from Wayne with a degree in finance and economics, I've done a lot of things. Didn't choose a particular profession to be a doctor, lawyer, or whatever. So ended up in business with my dad. We had a scrap business. Yeah, later on it was called recycling, and it was difficult situations of working. In the city of Detroit and things like that. And, we ultimately sold the business. I got involved with something totally different. I actually ran a barter exchange where businesses traded their products and services. And that kind of really gave me a unique perspective to understand, whatever business somebody was in, they thought that was the best business, but we would help them basically create, additional, one thing I really remember in learning is, how to use unused capacity. So we helped the restaurants, sell more food, hotels, fill their, fill their rooms, dentists, whatever. And it was really a very unique experience to, sort of serve as a consultant or whatever, to be able to help them improve their business. And I, really enjoyed that. And, quite honestly, was, quite successful at it. And, moved on from there. And that's actually when I became the CSA. Moved on from there. My friends were involved with estate planning, and so why don't you come in and work with us? And in the estate planning business, that's where I became the CSA. Started working with seniors, and I really enjoyed working with seniors. And I grew up. I unfortunately only had one set of grandparents. Didn't have the opportunity to meet the others. Spent a lot of time with them. Always enjoyed working with seniors, and we developed a program to educate people, to let them understand about proper estate planning, proper financial planning. Again, I'm not a lawyer, I'm not a CPA. I was not really directly involved with insurance products or financial products, but we developed a program to educate people so they could make the right decisions for themselves. We found out that different groups needed specific assistance. So we had groups specifically for women. We began working with churches and really started a strong network. And the network ultimately led me to developing a newspaper. So about 15,
Stuart,
16
what are
years
the
ago.
key events happening in the healthcare world?
Key events in the healthcare world. So if you go forward, into the healthcare world, the baby boomers that we talked about. Well, those baby boomers are now 76 years old. The average 76-year-old is going to use a lot more of the healthcare system resources than a 56-year-old would have been 20 years ago. So the healthcare world really needs to look and figure out how they can deliver healthcare, the healthcare that's needed, but also how do they maintain, how do they maintain the expense? So one thing I often say is the healthcare world is really expensive, and it's really confusing. So what's happening in the healthcare world are a lot of different types of organizations. One of the there are a lot of groups that manage physician offices and help them to try and meet certain merits for them to be able to go ahead and provide health care, and do testing and do labs and do things like that to make sure people are following along a program and getting the right health care.
Stuart, why is COVID-19 causing so much conversation regarding population health?
So, population health really has become, a buzzword, a target word is, looking at different populations and classifying, people, risk, not at risk, back in March, they were taking a look at, older people would be more at risk, and obviously they were correct. People with multiple, conditions, would be, more at risk. So, people need to know, even if they're not diagnosed. Many people have things and they're not diagnosed. I happen to have asthma. So when my son came off the airplane from LA, he, views me as being old. And he's like, well, I need to stay away from dad, and truly, people have to understand that more risk for him to be next to me than maybe my brother who's 4 years older who doesn't have asthma. So it's, really important for people to understand, what they have, and, what they need to do and, be proactive, in their healthcare.
Tell us about your new endeavor, the HealthWatchers.
So HealthWatchers really is turning out to be a very interesting opportunity. So, prior to this, I've been involved with operating physician organizations, very well informed in the area of home care and laboratories and things like that. And what's happening now is the healthcare providers themselves need to make sure that they're properly prepared and tested and things like that for what's going on. So what HealthWatchers does is we've coordinated our efforts with about a half a dozen different physician organizations, visiting organizations, and laboratories. And HealthWatchers is bringing to the public, and we're working with churches and things, but bringing to the public, services that they need. People who don't go to the system for healthcare ultimately cost the system more. A homeless person on the street ultimately could cost the system more than someone who's living in a $500,000 house. So what HealthWatchers is doing is going out to the communities and bringing them services they might have, not been familiar with. So right now, what's happening is, COVID-19. So we are teamed up, and we are in churches weekly and working with masses of people, helping them to understand and educate them what they need to do, and when needed, provide different types of testing, whether it be antibody testing, testing that provides information based upon your bloodstream and providing that, or if they need what they call a PCR test, where it's actually a nasal up your nose that goes back to molecular lab, and the lab can determine the strain of virus if you have it or you don't have it. Very important for people to know, and we're out there, and I'm out there at times also, and we're all out there with the correct PPE, and hopefully everybody's going out with their masks and the right PPE and keeping their distance. But it's a different world right now, obviously.
How is it doing right now?
Fortunately or unfortunately, we're doing quite well. My phone rings quite often. Even like, yesterday, got a call from a group home or a bunch of group homes. They have 27 group homes with developmentally disabled people. And they have people who live there and they'll be there for a long time. But the people who work there go in and out. They have about 160 employees. So, they need to make sure that those employees don't come in and, infect their residents who are there, who, other than their developmental issues, probably have a lot of underlying health issues. So we're able to go ahead and, bring those services out to them to make the company more comfortable and to keep the company moving forward. So we're very fortunate that we're here to help.
Stuart, you are the CEO of United Practice Solutions. Tell us about that, please.
So that is a really important business. Now, it's a business that doesn't work directly with the community, works with the physicians. My partners in that business have been in the medical billing space and the electronic medical record space for many years. And what we're doing together is we're actually bringing out new services for the physicians to better improve their patients. And most of these services actually are going to our, a gracefully graying group. People over 65 are entitled, if their physician wants to provide with them, chronic care management services. So what it's able to do is able to provide services in between office visits. So United Practice Solutions will work with physician offices and provide staff software support to bring in really needed services. These chronic care managers will work as almost like a health coach to make sure they've picked up their medication, they're taking their medication, they've gone to the specialists. Are things changing? Have they fallen? A lot of times people will fall and not let anyone know, and that fall is leading to something else. So United Practice Solutions brings that in. This year, Medicare started a new program available called remote patient monitoring, where your physician, these are all things through your physician, but you can go back to your physician possibly and ask them. Remote patient monitoring, your physician can bring you a glucometer or a pulse oximeter or a scale or a blood pressure cuff, so you can actually take your vitals at home, and it goes via cellular to the cloud, and your doctor can actually know right away what's happening, be able to treat you right away, so your blood sugar is not off track for 5 days and then you go call them. So these are all things to help improve the quality of life for patients. And
So we're in the middle of a worldwide pandemic, COVID-19. How has this impacted on all of your various projects?
Well, it's changed the way healthcare is delivered. And one of the things I'm really involved with is the delivery of healthcare. So as we all know, many physicians got involved with telemedicine, and the insurance carriers, including Medicare, modified rulings, on how telehealth can be delivered. I actually work also with a telehealth organization, and we're able to provide that. But it did cause a little bit of an issue with people would see their physician, okay, and they could potentially have their medications renewed, okay, but how are they getting labs if they need labs, or how are they getting diagnostics if they need an ultrasound or things like that? So some of the companies that HealthWatchers is affiliated with are able to do that, and we're still doing that. Reduce the amount of in-face visits, but there were times that providers that we work with did go in, and unfortunately, there are many people in the healthcare world who ended up testing positive. Even this week, one of the groups I work with, unfortunately,
What are your goals with these current ventures that you're involved in?
Well, the goal is to have a long-term sustainable model of delivering healthcare. And what HealthWatchers is able to do is to help, provide that and bring that service out to people who might not know or need. They need the service. They don't know what, they don't know how to go about it. So ultimately is to bring care out, working with the different organizations and coordinate care. And that's basically what is happening at United Practice Solutions. But at United Practice Solutions, the physician had to make the decision. I'm participating in a program. I think that our involvement will help more physicians to understand and patients to understand that having your annual wellness visit, going in and having your annual wellness visit, will be a benefit. Part of an annual wellness visit is also, to discuss, unfortunately, the inevitable, advanced care planning, which takes me back to my days of doing estate planning seminars, which I did all around the country. People need to know, okay, I need to have my plan. So, there is a need for education, and the systems are out there, things are out there. It's just physicians are overwhelmed. So we have the ability to help the physician, to help the patient understand, and be able ultimately, everybody ends up in a better situation. And that advanced care planning document, I'm sure your estate planning attorneys who come on here and discuss, wills and trusts and power of attorneys for healthcare and financial. Many people don't do it, or they do it, they don't know where it is. And physicians also can participate in helping patients make those decisions.
Stuart, how can all of this fit in with Gracefully Graying, which is, what we're working on and what we're building?
So it was interesting how I came across Gracefully Graying, through your associate, Lori Bloom. And then, you and I have had a number of conversations together, and we know all the same people, but never knew each other. And, it's really all about people working together. I mentioned years ago, I had a publication called The Mature Advisor. We were doing some of the things you're looking to do today. And that's something I really enjoy. We work with the Diabetes Association and the Cancer Society and that. And really, everyone needs to work together. The Gracefully Graying platform, I think, is really a great way for even all the people who've been on Gracefully Graying someday to have virtual get-togethers, and how they can meet up with each other. So I think all of us working together. Actually, yesterday I'll give a shout out to Walton Wood, which is a very nice assisted living community. They had a virtual networking meeting yesterday. And 2 days ago, they show up at my house and they deliver a nice big basket to make pancakes. And they suggested, everybody, make your pancakes, and you had pancake mix and chocolate chips and all these things, and let's all get together to a virtual meeting and work with each other. And we got to the virtual meeting. I actually never opened up my pancakes yet, but we were all together, and we just keep networking with each other. And on that call, I ended up getting connected with a group, which is a assisted living facility for nuns. A specific assisted facility. So there are so many things, even though I think I've been around this a long time and I knew everyone, somehow I never met you. And I think all of us knowing each other, can help each other, and really grow, because there's no rule on how to get old.
It's a huge community. Groups who are 45, 50 and over are the majority of the population, not only in Michigan, but in the country. So, you're talking about millions and millions of people who are under the category either needing medical services, legal services, or just learning about a lot of the things that we're doing to live life fully, which is the motto of Gracefully Graying. How would you say the coronavirus has impacted upon your plan, Stuart?
It hurt, many of the businesses, because, we work very closely with the home care agencies and and the home care agencies actually couldn't physically get in to see many of their patients. So, it slowed down a lot of things. And, people at home, are not moving around quite as often. And, there's a lot of impacts on that. Some of the providers who continued to go out ended up themselves, contracting, COVID-19, and people really have to be careful. You see someone, then who do they see? Then who do they see? So it's, our situation, because what we're doing, fortunately, we're in we're generating a lot of new opportunity, and making new connections, and I'm able to help my connections make connections. And, that's going great. And I think that for the long term, the delivery of healthcare is different, but, certain things have stopped.
Stuart, I recently interviewed Joe Gleason, the CEO of Genius, regarding the launch of the Genius Connect app. You are also affiliated with Genius. Are there any updates on what is going on with Genius that you could share with us?
Now, Genius obviously is a great partner for Gracefully Gray, and Genius has been in development for about 5 years and has created incredible opportunity for communications. Because when people are not communicating, there's a lot of other psychological issues in that. Fortunately, they're just getting ready to launch out to the assisted living facilities. The assisted living facilities are really having a difficult time monitoring between the patients inside and the families who can't get there to see them, and how they're able to provide tours to facilities. So Genius is just ready to launch, and their number one endeavor is actually to the assisted living communities at a time where it's really, really needed. And I'm sure if people saw the interview with Joe, the CEO, there's incredible things it can do. But the communication, the communication really is they have the ability to get information right onto someone's cell phone. And when you need information, they have a proprietary number, 211-411. So if anybody who saw this ever texted 211-411 and they texted the word assist, they can get information specifically about that. If they needed information on something different related to their particular organization, their particular church, Meals on Wheels, everything I'm doing, everything you're doing, everything Genius is doing, everyone working together, I believe we can provide, the right information and really make a difference, and not just only in healthcare where I'm primarily, but in all these areas.
There are a lot of important issues that we're all facing. What are some ways for all of us to move forward in the health management field during the age of COVID-19, which, it's going to be with us for a while, it looks like. I mean, if anything, as we're speaking now, it's getting worse in many, many states and is not receding really.
That's a really difficult question. I think people really have to stop and think, unfortunately, about everything they do. And you can't, not do anything, but you really got to take a good look at, where you go and who you're exposed to. I think that people do need to remember that you can't just not see your doctor or not get some of these important tests done, have your blood drawn or whatever. So I guess you have to, sort of pick and choose. I think that, if your doctor and you're gracefully graying and you're on Medicare or whatever, and your doctor wants to, have you a part of a remote patient monitoring program, it would probably be a good idea, to have these devices at your home, so that way you can communicate with your doctor and maintain your health, and maybe not have to physically, go there as often, make sure you're available for telehealth visits, and, sometimes when you need that specialist, specialists are also available via telehealth. So I think you just have to look at, different, ways of doing things, but people can't just not go to the doctor. The same thing, the dentists are opening up. You got to figure out how to, get to the dentist and hopefully, have a dental office that's following all the safe procedures.
It's very surreal now. I mean, I've been to a couple of doctor's appointments lately, and you walk into a building where the offices are, they screen you with questions. Have you had a fever, a cough, a headache, or any symptoms? And they take your temperature. They have you sign a form that you're okay, and then you're sent up to the actual office where the doctor or dentist is. And then you go into a waiting room where there used to be numerous chairs, and there are either very few chairs or else they're X'd out so that only so many, and then you're brought in one person at a time. So it's a very, very surreal and different experience, but it's something that's really critical. What advice can you give to those of us who are gracefully graying during this pandemic? I mean, one thing I think that's critical, and it's become so political, and it shouldn't be, is wear a mask. It can be the difference between getting sick and not getting sick, and it also can be the difference between being exposed and exposing others. So it's critical. But what are some other advice that you would like to share with us, Stuart?
Unfortunately, I think you have to pre-think before you do things. I was glad to hear that the office you walked into, had the chairs separated, but I happened to be in a medical type facility today, and I walked in and all the same chairs were there, and I just had to figure out how far I could sit from the next people. Now, it wasn't that busy, but if it was really busy, I probably should have made the decision to maybe go stand in the hallway, So I think you have to really, pre-think all of these things. But I think that, there's been a very big psychological toll, on people,
yeah.
And the psychological toll is you have to make sure you're communicating with people. I know there's some people who have really backed off, but this is actually a time where I know people have communicated with people who they didn't previously communicate, and they can have, conversations like this. My family actually has had some, really very nice, and my family's all around the world, some very nice, WhatsApp family groups where you get everybody together. And I think that's really important. And you got to figure out how to include, those older members of the family, because isolation is a problem. I think you really have to take a look and,
Stuart, we have about 30 seconds left. What are some final thoughts you would like to share with our viewers before we sign off?
Well, I thought about that because, I had these questions before. And as funny as it sounds, sometimes they say, who are you going to quote? Well, remember in Ferris Bueller's Day Off, I think the quote was, basically, you better look around because, world moves really very fast. I sat in the CSA program almost 20 years ago and thought, I was, the youngest of my family, and time goes fast. So I think you take care of yourself and get the right information.
Stuart, we're out of time. I want to thank you so much for being my guest on Gracefully Graying. I want to ask all of our viewers to watch Gracefully Graying, to share and like Gracefully Graying. We have not only the videos, but we have a tremendous website with a lot of valuable information. Again, thank you. And then, Stuart, I really appreciate
Henry, thank you, and stay safe.